What do you think are the 3 to 5 pillars if someone has to live for 100 years?
In terms of stress management, good sleep, good hydration.
All the skin disease,
So it ranges from a genetic cause, hormonal causes,
common treatments like men and women.
hair fall issues. Men specifically, they.
When it comes down to bathing hot water versus like cold water.
So it's a lukewarm water which is ideally preferred.
How harmful is like whitening screen?
The glow immediately within 1 week, 2 weeks of applying those creams.
Welcome to Real Knowledge Club Longevity Summit. Today we have one of the truly fascinating guests with us, who is one of the thought leaders, who is one of the Bangalore's one of the leading dermatologist and dermatologist surgeon, and like who is one of the toppers of her college at like MBBS from like Karnataka and like MD from Telangana, right? And she is one of the uh, person like whom you need to learn, like if you have to learn about like how to live long, anti-aging, and how to live young forever and everything, right? And she is an expert in like skincare, hair care, reducing biological age, pediatric dermatology and everything, right? The future of health and like best tips like you will be able to learn from today, right? Without any further delay, let's all welcome the one and only, right, Dr. Navya Suresh, and all thanks to her like sister Vindhya also for helping me connect with her. Right. Without any further delay, let's all welcome Dr. Navya to Real Knowledge Club Longevity Summit. Hi, Akka. Welcome to the show.
Hi, hi. Hi, Akshay. Thank you for the invitation.
Yep. Thank you. Thank you for taking your time. I'm super excited to have you with us at the Real Knowledge Club. I'm so curious and I'm so excited to know about your backstory, right? Like, what was your exact vision and like motto? What inspired you to pick like dermatology as your profession?
So yeah, when I was doing my MBBS, what was more fascinating is like, I was more interested in learning my surgical skills. I was had good surgical skills is what I learned when I was doing my internship from my surgeons. And as a child, I was very much interested in adding the details to my crafts, adding the fine details, like worrying about the symmetry, the proportions in my paintings. So, in that way, that is how I chose skin. And in dermatology, there is vast. It's vast. There is varied conditions, like multiple skin conditions, which are inflammatory, infectious, malignancies, and diagnosing each condition, differentiating between these two similar conditions, arriving at a diagnosis and treating is what is very interesting. And also coming to the procedural dermatology, what is commonly known as cosmetology, where we deal with the enhancing the patient's looks, the patient's well-being, which is just improving the patient one's own well-being. So in that case, correcting the symmetry, correct enhancing one's features, one's own features, where it comes in picture. And other sub branches of dermatology, not only these, that we have interesting cases in pediatric dermatology, diagnosing the child's condition, counseling the parents about the condition, giving them satisfactory results. And also dermatopathology. There are some multiple interesting sub branches in dermatology. So skin is the vast, it is the one of the largest organ, if I can tell you. So it is the index of one's own physical well-being, mental as well as emotional. That is an index of it. So it is very important to treat any conditions, to enhance the personal well-being. So that is what is fascinating about dermatology. It's not just cosmetology, like how the world knows about dermatology. It's not just cosmetology.
Absolutely. That's an amazing journey. I love that. What was your traits? I'm so curious to know, right? Like when I think like you studied at like Navodaya and then like the Bemel college. When I was going on the weekends for that, I think IIT coaching or something, I used to see your name board on the leaderboards, right? And you were the number one topper in your school, college, your MBBS and MD, and even your sister also, right? What actually, like for all the aspiring doctors or like need people and all, right? What it takes to be on the top number one. Can you tell us about that?
Uh, like it's always only one mantra, that is hard work. Hard work, hard work, and hard work. Along with that, love for my subject. Specifically, when I chose medicine, my mother is the one person who inspired me to become a doctor. And and again, when I chose dermatology, it's my love towards dermatology, the perseverance, the determination towards my subject, and again, curiosity to learn more. And that is how I kept on keeping my mind to pass on so many exams as a medico and come to this stage. I am just grateful for that.
Amazing, amazing. How many hours like you were like studying in your MBBS or like MD days a day?
So, like, we had a very good friends group. It was always I like give the credits to my friends. So we had that intricate group. We used to do group studies. So that is
Wow.
what helped us to remember things, put it out practically into our daily practice. So the same thing we followed for our NEET coaching also. Yeah, for a NEET coaching, it was almost 10 to 12 hours per day was what we used to study to like catch up that competition and just try to like get some good seats from government medical colleges. Yeah.
That's an incredible journey. Amazing. And if I have to ask you, for all the people, especially the longevity enthusiast people, what do you think are the 3 to 5 pillars if someone has to live for 100 years? And is there any way someone can actually practice from now so that they can stay young forever, right? How they are at like early 20s or like 30s?
So, as a dermatologist, if you want me to give some key points, so it is
Sure.
mainly healthy lifestyle in terms of stress management, good sleep, good hydration, and good diet. And in terms of skincare routine, it's you have to invest on a good sunscreen, which is not only helping you to reduce your tanning, it is also the best anti-aging cream, if I can tell you. In again, a good skincare routine in terms of moisturizers, retinol based serums which you can use on a regular basis. Yeah, these are the like keys to longevity according to me. And yeah, and being consistent with all this. It's not just okay, 2 3 months I use it and after that I'm done. It's not like that. Easy skincare routine and consistency is the key.
Love the insights, right? Like we have to be consistent, putting the
Yes,
sunscreen
yes,
wherever we are going, and right sleep,
yes.
right diet, right? Do
Yes,
you
yes.
recommend like nowadays like so many people eat like outside food, like junk food, like masala puri, pani puri, the palm oil, all these things? What's your thoughts on it?
So I would tell them that see these oil things. So what happens on a long run? So it depends upon how many times a week you eat. That is also an important factor. So okay, once or twice in a month is okay, but like it has a negative impact. It has bad oils. Okay, it has bad sugars, which will have an impact on the skin health, the skin health. Yes.
Absolutely love that insights. And what do you think is the root cause for all the skin disease? Some people get like so many pimples and all these things, right?
So when you tell skin issues, it's not just one. There are multiple skin issues. So and in dermatology, it's a varied causation. So it ranges from a genetic cause, hormonal causes, thyroid hormones, the female hormones like estrogen, progesterone, FSH, then emotional causes, lifestyle causes, again stress, food, hydration, and again any underlying health conditions like diabetes, hypertension, hyperlipidemia. So all this together would be the reasons for an underlying skin issue.
Absolutely, absolutely got it. And what are the basically common treatments like men and women come to your clinic to seek help and support?
So, like again, dividing gender basis, men, women, and according to the age group also. So, the most people who walk into my clinic are adolescent men and adolescent women. So, they come for hair fall issues. Men specifically, they seek for hair fall where they we call it as a male pattern hair loss or an androgenetic alopecia. Other than that, they come for pigmentation, pimples, or acne problems, and again some dermatological conditions like seborrheic dermatitis or dandruff. So these are the common things. In females, it's more related to the like skin rejuvenation, just for the skin, glowing skin, for a healthy skin, as a part of anti-aging treatments. Like it could be a chemical peel or a Botox treatment or even some laser rejuvenation. So these are the common things. Again, we have some children who are coming with their parents. So the parents are worried about the dry skin issue in the children, specifically now the monsoon and the winters, where atopic dermatitis is more common and allergies. So they apply something on their face, they get allergies. And then some infections, contagious infections. These children, they are school going. So there are multiple contagious infections which we see on a day to day basis, like scabies, some bacterial infections, and some contagious because of contact sports, like the group or sports which they play at school, warts, molluscum. So these are the infections which the children come up with. And again, the other population who come to the clinic will be the geriatric population. So again, generalized itching, some wheals kind of thing, which are on and off. So allergies, urticarias. So like this is how we cover up. And again, some nail disorders also are the patients who come.
Amazing, fantastic. And it's always like important to come and seek help before it spreads, right? Like always taking coming to a doctor is
Right,
the key.
right. Definitely.
And what do you think when it comes down to bathing hot water versus like cold water, which is better for the skin and like longevity?
Okay, okay. So if you are asking me this question, then yes, I would tell you it's a moderation. It is not like too hot, not too cold. So it's a lukewarm water, which is ideally preferred to bathe for your body as well as for the scalp. What happens, no, whenever you like in this specifically this winters, if you try to take bath in a very hot water, so you'll feel very nice, you feel relaxed and all that, but it strips off that oil content of your body, so it you feel your skin becomes very dry post bath. Okay. And if it is very cold, yeah, few prefer cold water, but few complain to me that saying that doctor, after using a cold water, I don't feel that my body is clean. So to balance it
Right.
out, something lukewarm water would be better.
Yeah, absolutely. And some people do that cold sauna, like sitting in the ice and then all those things. What's your thoughts on it?
So yeah, like indirectly it helps in moisturize, like it hydrates the skin. That is how they feel that there's a glow. And also to some extent it also has an implication on the vascularity of the skin. So that is why, so it's not harmful. You're not applying anything harsher on the skin. Otherwise, yes, not harmful. Not, it's better than using some harmful products, over the counter products on your face.
Absolutely love that. And doctor, what you think? Why do so many people look tired these days? Right? How do you want to address them? Like how to stay with high energy and everything?
So tiredness is a very, again, if I can tell you, there are multiple causes. First thing of tiredness is any underlying health conditions. So whether it's just the facial tiredness or a generalized tiredness, again, lack of poor nutrition, lack of sleep. Okay, so coming to the face, if the patient just he is physically and mentally good, but the face he is feeling tired, just like a tired look, I can call it as, then we need it might be a too much oily skin or a true dry and a dehydrated skin. So yeah, from my point of view, but still his face is looking tired, then these are the reasons. So a good skincare routine needs to be advised, and also hydration from inside is also important.
Absolutely, absolutely. Love that. Doctor, in your opinion, what defines a cosmologically good-looking person, male and female? How do you consider someone is like healthy, not healthy?
Okay, okay. So when it comes to like good looks, I would modify that sentence and say it's a healthy skin. So rather
Okay.
than a good looks or a fairer skin, I would prefer in my practice, I follow something which is healthy skin. So according to me, what is healthy skin is so a good hydrated skin. Facial is symmetry, like if a person is cosmetically, if you want to define a person cosmetically, the both the sides of the face should look the same. So this is judged in terms of facial symmetry, and then some facial prominences. So we have this malar prominence, jawline prominence, and a good nose shape is important for a person to look good, cosmetically better. Yes, so that is very
Absolutely.
important rather than the color or the tone of the skin. And also,
Um,
yes, again, the lesions on the face with like acne, clogged pores, pigmentation, and scars also needs to be addressed. Yes.
Amazing, amazing. And I love that. And what do you think are the basically the side effects of cool sculpting, and how effective is that treatment?
So before that, it's important to know what is cold sculpting. Cold sculpting or cryolipolysis is it's called as. So it's not that it's not the one which I practice in my routine basis. So it is definitely a proven one practiced by few of the dermatologists or few practitioners, registered practitioners. What is the basis of this procedure is, so there is a resistant fat in the body, mainly the lower abdomen, upper thighs or upper arms. So this resistant fat, what if I tell the word resistant fat, it means it is not reducing with a proper exercise diet. So then this resistant fat, what is done in this procedure is we like subject it to a very cold temperature. Okay, so that in that means we are causing adipolysis, that is burning the fat using a cold temperature. So if it is done by a proper practitioner, proper instrument with proper settings, ideally there is no side effects. But yeah, some like abnormal side effects, like in that area, some sensation loss, like numbness, like cold burns, discoloration of the skin, and very very rarely paradoxical side effect is instead of decreasing the fat, there are chances of to increase the fat also by like it's a paradoxical effect.
Oh my God, it sounds scary. Yeah.
But it's a rare thing. Don't worry about it.
Okay, got it.
Yes.
And what do you think are the potential side effects of like IV therapy, right? Should it be like readily available, or like what's your thoughts on it?
See, IV therapy is becoming very prominent now. Specifically, these IV antioxidants, IV vitamin C, glutathione therapies. So, when it is administered by a registered practitioner, like then yes, okay, it's well and good. If the patient wants it, yes, it is well and good. But if it is done by a local persons, local clinics, beauty parlors also are doing these IV therapies. I don't know, but yeah, the sterility is not maintained. So injection side effects. And the dose, if the dose is not properly given, it can even lead to some kidney problems. On long term, it is like bad when it is not done by a proper person. That is what I would tell.
Absolutely, got it. Got that. And can you explain what is this Botox and what are some of the key factors of this treatment?
Okay. So Botox, see, Botox is like a injection. Okay, it is available in vials, so it is an injectable. Okay, so Botox, what it will do, it will try to of the face. So it is used to treat these dynamic wrinkles. So it's a part of an anti-aging procedure. So as we age, like after 30, 35, so what happens when you try to raise your eyebrows? We have these forehead lines, and around the like these frown lines, crow's feet, that is the lines, fine lines which is around the eyes. So mainly Botox we inject, we numb this. It's a cosmetic procedure. It is a completely painless procedure. Small micro injections are given in these areas so that the you don't get those wrinkles after that procedure. So this is, but the thing is, it's important to know that it is a semi-permanent procedure. So, like a regular backups, like every 6 months, every 6 to 9 months, like the patient has to take, the person has to take to maintain that looks. So yeah, and there are again so many like actress and some social celebrities who have like had a bad Botox. So asymmetry of the face, where I had mentioned you Akshay about
Right.
a cosmetic, how like the cosmetic appearance. So main thing is the symmetry as well as proper proportions. That is what is important about Botox. And again, loving my general dermatology, we have some non-cosmetic indications of Botox also. Like I have given patients Botox to patients who have hyperhidrosis. So
Mm.
hyperhidrosis is excessive sweating. So like I can just elaborate a small story. So we have a colleague, a surgeon who is sweating excessively on the forehead. So once he tries to do his surgery, tries to look onto the OT bed, so there are dribbling, the sweat is dribbling from his forehead, so he is not confident to do his surgery. So in that case, we planned for a Botox treatment for the forehead. So we counseled him. He was okay. So and the effect is immediate. The Botox effect is immediate. It comes within like 24 to 78 hours. So now he is able to do his surgeries confidently. The sweating, we have crashed down the sweating. So the sweating is completely absent on the forehead. So that is how we were able to help him with the hyperhidrosis. And also like uh, adolescent or teens were writing their exams but excessively sweating on the hands. So I give Botox to the palms also. This
Right.
regulates the sweating of palms. So they had problems like when they're writing these exams, no, their and exam sheets were getting wet. They were not able to submit it. So such
Oh my
problems.
God.
So that
Yeah.
also were we were able to, like I was able to counteract with Botox. Yes.
Amazing, amazing. And it's mostly like celebrities, kind of these people actually try to do all these things, or like is it like everyone also are doing
See,
these things?
Botox is the simplest procedure. It is very, very simple. And like it's mainly the awareness. It is done by most of the individuals. We have patients in all ranges. It's not like I cannot tag it as a very expensive procedure. Yes, it's a procedure. The costs are there, but it is not only confined to the high range or celebrity procedure. It's not at all like that. Anybody can take it. I told you, even non-cosmetic tricks which people are not at all aware of. Yes, so that awareness should be spread. There are other indications of Botox as well. Yes.
Amazing. Love that, doctor. And doctor, what's your thoughts on it? How to stay like well hydrated skin and how can one achieve it even if they don't have like lot of money? What advice you want to tell to all these young people who are in their 20s?
Yes. I am a poor patient doctor. I have done my post graduation, done my further work in government hospitals. So I am not that kind of a posh dermatologist who gives a very high range of skincare products. It's not like that. Yes, coming to your point, hydrated skin is so it is importantly hydrated from inside as well as hydration from outside. From inside, like lot of water. So quantifying your water. So it's not like okay, I drink water. It's not like that. You should know how much amount of water you're drinking per day. So I would suggest is like fill your bottles in the morning and try to calculate how much water you're drinking. So that is hydrating from inside along with lot of hydrating fruits, hydrating vegetables also, yes. And then hydrating, this is hydrating from inside, yes. Hydrating from outside is good moisturizers. So a paraben free, a fragrance free, good moisturizer, and applying frequency is also important, at least 2 times in a day based on your skin. So a person, if he has an oily skin, he can go to water based moisturizers, hyaluronic acid type of moisturizers. If he has a dry skin, then he should go with a heavier moisturizer. It's like a skincare is always individualized. We cannot like generalized skincare. It is each type of skin is very, very different. So it is always individualized.
Absolutely love that insights. And what fruits like you will recommend everyone to have?
So the easiest fruit is watermelon, muskmelon, lot of apples and berries, lot of vitamin C, antioxidants. So hydration also is taken part. It is also anti-aging, good skin. Yes, from my point of view, lot of vitamin C also in your
Correct.
food, at least 3 to 4 times in a week.
Absolutely love that insights. I believe even coconut water is also much
Yes,
better than the
yes,
Coke or like all these things, right?
right. Good hydration.
Absolutely. I love that insights. And doctor, like how harmful is like whitening cream, right? And what are its alternatives? Like nowadays, like there are so many companies which is coming and most of them are like so expensive, even like 10 grams, 20 gram is like 500, 600 rupees, right?
Right.
What do you recommend?
See, like whitening creams, yes, there are expensive ones. There are ones who are cheaply available whitening creams also. Those are triple combination creams. So a patient get the glow immediately within 1 week, 2 weeks of applying those creams. But long term, anything which is containing hydroquinone, steroid, and retinoid. So if it is used in a adequate percentage prescribed by a proper person for a proper period of time, it's okay. But if it is used excessively, example, more than 2 months of usage, people use it for 6 months, 1 year, 2 years, so they end up to the dermatologist with a lot of acne, skin thinning, redness of the skin, photosensitivity. So these are the adverse side effects which we encounter in our routine practice because of these whitening creams. But there are good whitening creams which contains milder one, but these are not as quick, so they should be applied for good amount of 3 months to get a good effect. So anything which contains glutathione, niacinamide, arbutin, kojic acid, so they are, yes, good enough. So again, it is again individualized. It depends upon what condition are you using those whitening creams. Any black patches are there on your face? How depth is the pigmentation? All this. So it's not recommended to buy whitening creams for yourself and use it. It is better if you can consult a dermatologist, take their advice, get it checked, and then start on with these creams. Yes.
Absolutely. That's really insightful. And doctor, what do you recommend, right? Like there are so many teenager girls who do like makeup, right? And what should they actually consider?
Okay, so I would correct that sentence. It's not just teenage girls. It's all the age group, yes.
Yeah,
So,
yeah,
and
yeah.
not only girls, it's male, female, everybody. They want their
Right.
skin to be better. Nowadays, there's a lot of awareness. There's a lot of difference when I was doing my residency and now. So yeah. So when you ask me about the makeup, if I deny the makeup completely, they would not come to me again. They would tell me I'm a bad doctor. I'm not allowing them to do what they like. So in that case, I would suggest them to go with a non-comedogenic. That means after applying, that doesn't clog their pores, that doesn't cause them eruptions. And as much as possible, use makeups only whenever there is dire necessary Okay. And then use a moisturizer and a sunscreen with the makeup. Cleansing the skin is very important. Immediately once they come back home, they have to remove the makeup, cleanse their skin, nourish it again. So these like practices will help them to maintain their healthy skin. Yes.
And doctor, like, what do you think when it comes down to applying like sunscreen, right? Which sunscreen like we should basically apply? Of course, in Bangalore there is no like so much sun or something, right? It's like very good temperature. If you go to some places like Dubai or like some other places, it's like so hot, right? And what should we actually wear? How should we protect ourselves from the sun?
Okay. See, sunscreen is the best. I think I have told the same sentence before also. Sunscreen is the best cream where you can invest on. Yes. So any good sunscreen which is dermatologically prescribed with adequate protection. Adequate protection means it should cover UVA, UVB as well as visible light, and SPF anything more than 30 is again good. And it is important to apply sunscreen even if you are indoors, because it's not just the heat of the sun which you're trying to protect, it is like the visible radiations also. So because it helps you prevent tanning, it helps on a long run, it is anti-aging. It works for your pigmentation, it works for fine wrinkles and all that. So yeah, investing on a good sunscreen is important. Amount also is important. Again, amount depends upon the nozzle size. So when we open the sunscreen cream, so the tip of the cream is called as the nozzle. So ideally it is 2 finger tip units, we call it as. You have to start the sunscreen from your fingertip till the base of the tip, and it is important to reapply the sunscreen again in the afternoon, at least like what is theoretically what I'm trying to tell you is 3 hourly application of sunscreen is important for an ideal protection. Yes.
Yeah, which I think most people don't do it, right? In India,
Yes,
every
yes,
three
it is
hours.
very difficult. It is very difficult. So the easiest way is morning once and again reapply it in the afternoon again, right? At least that
Absolutely.
would be a easier method, better than rather than yes.
For that. And doctor, do you recommend any product like sunscreen? Means there are like so many, right? Do you recommend any brand or like company for like men and women? Is it like separate or like they can just
Uh,
take one and like use it?
No, no, no. It depends upon the skin. So the
Okay.
sunscreen ingredients will be common, but the base which the sunscreen, whether it is a matte finish, cream based, lotion based, so that is different. So ideally for the hand, it is lotion based sunscreen. Okay, I don't prefer going to the stick based sunscreen because it contains lot of waxes which can aggravate your acne lesions. So if it is a very oily skin and all that, then better go for non-comedogenic sunscreen, which are lighter. If you want me to name one, you can go with Episoft. So that is a very good sunscreen and a lighter sunscreen which contains even lighter moisturizers for specifically oily skin. If you're acne prone skin, you can go for Acne UV or UV Do sunscreen. Even Suncross gel based sunscreen is also good enough. Yes. These are the
Absolutely.
sunscreen which I use in my routine practice, and my patients are very happy with these.
Wonderful, wonderful. Guys, do check out. You guys also have to start using it, and I'll also be using all those things very soon, right? For that. And now we'll be going to the part 2 of the interview where like I'll be asking you right like about hair loss, right? Nowadays, now when I was actually having a word with my friends and everything, even with the saloon, like when I asked him like what's the main reason, like he was telling because of global warming. Some are talking about, some are telling it's because of the gene. Your father had a hair loss, that's why even you'll have. What do you think, doctor, is the root cause for the hair loss?
See, again, hair loss, trichology, where I call it as in dermatology, it's a vast thing. So we cannot, again, there are varied causes for any hair loss. So it's important to differentiate whether the person has a patchy loss of hair, which is more autoimmune, which we call it as alopecia areata. If it is a diffuse loss, then we have to know the pattern of hair loss, whether the person, male or female, whether he's losing the hair over throughout the scalp overall, Otherwise, he is losing, like in males specifically, there will be frontal hairline receding. That means the hairline which was here has gone back, is what they complain of. And also the vertex hair loss and the frontal hair loss. So that is what this is a very typical complaints of an androgenetic alopecia or male pattern hair loss. Other things which are the causes of hair loss is nutritional, because of nutritional like deficiencies of iron, biotin, zinc, and some protein deficiencies also. Other than that is the regular lifestyle, as I've told you, that plays a major part. The lack of sleep, stress, again some emotional imbalances also are the part causes of hair fall. And again,
Absolutely.
deficiencies, I would want to mention even vitamin D, vitamin B12 deficiencies, again, thyroid disorders. So these are the medical causes where you come to a dermatologist, we do some basic tests. So it's not like you come, a hair fall patients come to me and I just give some serums. It's not like that. We evaluate as a whole. We see what are the causes in that individuals. After that, like if any deficiencies are there, correcting those deficiencies along with some hair uh, care products is what the person requires, and counseling about the condition, making him understand where he is standing and what can he expect in the next 1 year, 5 years, 10 years. Discussing about the treatment modalities is important. Yes.
Absolutely, that's really insightful. And doctor, what do you recommend? I have seen like so many people who were having the hair loss. They're going to so many other doctors. They're using so many like that this thing, right? Like ointment or like oil, and still they are not able to completely eradicate that hair loss, right? Again, to regain it. What is the by far the best solutions, right? What are the best treatments, what one has to do even if they don't have like a lot of money, how they can treat their hair loss?
Okay, okay. The main thing is nourishment. Hair grows in cycles. We have the growth phase, involution phase, and the end stage of the hair. So, like the whole hair loss treatment, like surrounds around like that. We need to increase the growth phase, which we call it as the anagen phase, for which the hair nutrients is required. So, tablets in the form of biotin, iron, zinc, which is comes in a single tablet. So every day they can take it for 3 months. Along, this is for a milder hair loss, which I am talking about, and some hair growth serums is what it will help for a person who doesn't have any other causes, any underlying causes. So this will be the basic treatment. There are patients who come walk into the clinic with higher grades of hair loss or alopecia, where we have some professional treatments for them in the form of PRP, GFC, scalp microneedling, lasers, as well as some growth factor injections, stem cell injections, and also hair transplantation. Yes, there it is varied. It's so it. I would if any person hair loss is there, first the thing is they need to analyze for themselves whether only it is only hair loss or whether they are losing their density. That means when they try to part their hair, whether the scalp is visible or no. So first they can, if it is only hair loss, then again some diet modifications, lifestyle modifications they can try with. Otherwise, yes, definitely going to a dermatologist, getting diagnosed, treatment according to the condition is very, very important before they go into the moderate and the severe stages of hair fall. Yes.
Absolutely, absolutely. That's very insightful. And doctor, what do you recommend, right? Like there's so many oils, parachute oil, this oil, that oil, almond, or like there's like so many things, right? And shampoos also, right? Which do you recommend? What are the best of the best when it comes down man and woman?
So it depends upon the scalp type. So if a person is feeling that his scalp is oily, flaky, itchy, that means if you don't wash his scalp after 2 or 3 days, he goes on putting his fingers onto the scalp trying to itch. Then that type of scalp, they oiling like 2 or 3 days prior to the hair wash is definitely not recommended. I would just suggest them to oil 1 or 2 hours prior to the hair wash. In females, I would just suggest them to like oil their shafts, just leaving their scalp. Because what happens in this type of oily scalp, if oil is applied and it is left, so there is a fungus called as melassasia that feeds on that oil, added by the moisture, the sweating, so that causes furthermore conditions like dandruff, seborrheic dermatitis, whatever, this flaky scalp. So that is about oil. And if you ask me which type of oil, a plain coconut oil is good enough, yes. And coming to the shampoos, again, it depends upon individual. If they have dandruff, so I told you the flaky scalp, the oily scalp, then they have to go with ketoconazole, zinc pyrethroid, or cycloperox, which these are anti-dandruff shampoos. And if I have to mention about the anti-dandruff shampoo, better it should be bought in the pharmacy. You cannot use a branded anti-dandruff shampoo and expect your dandruff to be zero. It's not like that. And again, so the cleansing ones, it's always important to apply to the back part of the hair which is comparatively resistant to these chemicals, and again bring the lather out to the frontal area, the front area, and wash it. So that is what is recommended about shampooing. Yes.
Absolutely. Love that. And doctor, do you recommend even that condenser? Like some people after the shampoo is put up, they use even the
The
condenser, all those things.
conditioner,
Is it?
yes, yes,
Yeah,
yes.
conditioner.
So yeah, if they have frizzy type of hair, they have to just omit the roots or the scalp, and then they can condition the lower part of their hair. So that helps to maintain their hair, to like to get rid of that frizziness and dryness. Yes.
Absolutely, love that. And before we end, I have one of the curious question about like Michael Jackson, right? Michael Jackson had this goal of like living long forever and like longevity, right? He had almost 10, 15 doctors with him trying to test from everything from the food, what he eats to like skin, everything, right? What was the main reason? Like, why did he also die, right? He had some of the best doctors and everything with him always 24/7.
It's like too much is too bad, if I can tell you. Yes,
Yeah.
so finally, like I would suggest that whatever it is, you cannot load your skin, you cannot load yourself with too many things. Follow a very simple skincare routine. Go to a dermatologist. Start a very basic skincare routine which you can follow for a longer period of time. Consistency is the key. Definitely, it will be helpful. Yes, so that is how you can improve the skin health. Don't go for self based serums, like too many layering, seven step skincare routine or 11-step skincare routine. So yes, a basic skincare routine is important.
Absolutely. Love that. And doctor, how can people connect with you, right? If they have any questions, if they have to reach out to you on Instagram, Facebook, LinkedIn, your website, and where is your clinic right now so that if they want to consult you, come there at like Bangalore.
So I'm working for Narayana Health right now. So I'm a consultant dermatologist practicing in Bangalore, specifically in HSR layout. Yes, I am open for video consultations. Also, they can follow my page, Dr. Navya Suresh. Yes, that is, if you can type my name, Dr. Navya Suresh, in Google. Yes, there is a practo profile. Through that also they can take appointments.
Absolutely amazing, amazing. Thank you so much, Doctor, for sharing your incredible wisdom with all of us. And hey, guys, I also recommend you do follow Dr. Navya. I think she has a great Instagram page also, and you can learn like a lot of tips and everything. And do reach out. And if you are especially at and Doctor, any last words you want to tell to like everyone like before like we conclude today's summit?
Yes. So again, I repeat that healthy glowing skin is important. To achieve this, and each skin care is individualized, and each type of skin is again individualized. We cannot compare each and everybody's skin, and we cannot tell that I should have that type of skin. It's not like that. Your skin is great. Maintaining that, nourishing that is important. A very basic skincare routine and consistency, which you can see difference on long term. You will be able to appreciate that difference. Definitely, yes.
Absolutely amazing. Thank you so much, Dr. Navya Suresh, for sharing your incredible insights, knowledge. It was like mind blowing. And everyone watching this, do share it with your friend, tag your friend, whoever wants to have like glowing skin and everything, want to live long. And yep, stay tuned, guys. And we are planning for like part two of the interview also for other more insights as well. Okay, thank you, guys, everyone. Bye bye.
We all know India is the diabetics capital of the world. Our nation is facing a severe problem because we don't have that preventive healthcare education. And if you see, most of the people in India die apart from the old age is like cardiovascular disease, cancer, and high blood pressure, which can be easily prevented. And I discovered one of the greatest clinics, which is at like Chennai, which is AVO Clinic, which has like profound infrastructure and excellent cutting edge facility, and they are using artificial intelligence to understand what's happening in our body, the things what we cannot see or like ask like a normal person, right? And with precision, which leads to one of the most important things, like it's always told prevention is like better than cure. And if you are living an ultra busy lifestyle, want to take control of your health, I highly recommend you go to like Chennai at MRC Nagar, do your AVO 181 test and like understand what's happening in your body, like DEXA scan. I basically did that. I was able to understand where is the fats in my body, what I need to eat. I had the call with the doctor and they told me what food I need to eat, what supplements I need to do, and everything. And this will help you live longer. And I have put the link in the description. You can check out from that link. And also, if you're very serious about like longevity and want to live for 100 years and want to talk to like billionaires like Shiva Shankaran sir, like Aircel founder, I invite you for the 7 days longevity retreat, which is happening at like the Neela Palace, the 5-star hotel. People around the world from like USA, UK, Europe, and India are also coming. Do check out that event so that you are able to learn even more knowledge about like longevity and everything. And I'll see you at that event at January 2025. Thank you so much. Hit that subscribe button right now